There's so much conversation about mindset and whether or not somebody has the right mindset to accomplish their dreams. Mind4 really recognizes that there's an ability to create a competitive advantage based on the expertise that you have. And so we've created the Mind4 series as a series of one-on-one interviews with experts on a particular topic, whatever their expertise is. Phil Fasano is a strategic CIO, recently inducted into the CIO Hall of Fame. Who knew? He started his career in financial services, which is an industry that's known for requiring technological advances, and yet they still are suffering with legacy systems. And then became CIO of a large healthcare organization, Kaiser, where he wrote the book on transforming healthcare and crafted what we term these days as personalized healthcare. It's really the marrying of advanced technologies with the healthcare system. Phil Fasano is one of the true corporate entrepreneurs. So in preparing for our conversation, I actually did quite a bit of research. You're on the web quite a bit. You've got some wonderful interviews, both from financial services days as well as healthcare days. But the article that I found most compelling was the one that was prompting CIOs to pursue Chief Operating Officer positions. As you know, one of my primary areas of consulting is with strategic CXOs, and it really is those general managers who happen to have a major, if you will, in their functional areas. So strategic CFO, business manager with a strong knowledge of finance. Now you're actually saying the CIOs need to become general managers with a major in technology. What actually led you to that point, other than the fact that your entire career has played out being successful that way?
Well, I guess part of my career has turned out as a consequence of being successful that way, but it's really years of observation and leadership. When you think about the competencies of most chief operating officers, they didn't grow up in technology, at least not steeped in technology. The world we're in today requires leaders, regardless of their core discipline, to have a very strong technology component to their experiences, to be able to lead the kind of change that every organization is now going through or being faced with. Whether it's the need to change their products or services, or the need to change their operations and their capabilities from a core perspective, technology is a major component of all that change. And it's really important that the people that lead the change, particularly from a chief operating officer perspective, have the discipline of technology, have the competencies of operations, and truly understand what change and change leadership means from a psychological as well as an operating perspective. So you need the combination of skills. CIOs grow up in an environment where they're influencing change often. Often they're being told to cut costs. Often they're being told to make their operations more efficient. They have basic competencies in leadership, particularly those that become more strategic, that taking on the chief operating officer role makes perfect sense in today's world.
Well, when you went in and became the CIO of Kaiser Permanente, you redefined that role for them. Can you expand a little bit on that and provide some examples of how your role as a strategic CIO actually really influenced the strategic direction and the competitive advantage of Kaiser?
Well, I joined Kaiser from outside the industry. I didn't know healthcare when I joined the company at all. And so I went in truly as a CIO, looking at the technology challenges of the company. And there were many. And we had a particular commitment to a very major project. An awful lot of money was being spent to get that project done, and we were struggling. We were struggling because the infrastructure wasn't supporting it. The capabilities of the company from a technology standpoint and foundation weren't there, and we needed to make those investments. After getting the board and leadership to agree to the kind of change that had to happen in technology, and after being in the company about a year to 2 years, it became very apparent that healthcare was on the cusp as an industry, and Kaiser particularly was on the cusp of the technology changes that were coming our way. The opportunities that were being given to us by the technology industry were many, and there was no one articulate in the technology possibilities in the future for the firm, and what that meant to healthcare. So I ultimately took on the role of translating the technology into the future of healthcare. And by doing that, I became a strategic leader in the company, where I was being asked by leadership, the CEO, and the board to bring forth a vision for the firm entirely, as well as a vision for the future of what healthcare might look like if these changes played out the way I was expecting them to. Once I started doing that, it became an absolute expectation in my role that I would lead strategy and I would lead vision, and I would begin each annual discussion with the board with the art of the possible and what the next decade might look like in healthcare, and how Kaiser Permanente should lead the way. That gave me great opportunities to take on a lot more responsibilities, which just came with the territory, and truly influence change both in Kaiser, but then demonstrate in part what the change might look like for healthcare.
So and when you talk about technology within healthcare, and certainly having the title of CIO, I think a lot of people think, payment solutions, and the support that you have for the hospitals for electronic medical records. You're talking the entire expanse of healthcare, right? So personal care, home care, medical devices, pharmaceuticals. Can you describe some of the cutting edge and what you're seeing? Because you actually wrote the book on this, Transforming Healthcare, in 2014.
Well, the way I'll explain it, Kaiser Permanente is a unique institution. It is all of healthcare. It isn't just a physician group or a hospital system or a health insurance plan. It's all of those things. So what it was a great laboratory for the transformations that were coming from technology. When I started thinking about that and putting it together, yes, I had to build and implement the medical record system. And yes, I had to build and implement the core insurance management system, or the pharmacy system. In fact, during my tenure, we replaced every system at Kaiser.
Wow.
In addition to that, we invented many things and pioneered many things. Mobile phones, the way we know them, didn't exist when I went to Kaiser. Apple came out with their first product a couple of years later. Early on, we used piece of lucite and a camera and movie magic to basically demonstrate to the board our vision of what the future of healthcare might look like.
Oh my goodness.
Ultimately, with that vision, when mobile devices became available, it enabled us to truly demonstrate internally to the system, but then also in home health, what home health might be. We built an innovation center. We actually built a center with a home in it, with a medical center in it, and then laid on top of that many technologies to physically demonstrate how they play out in healthcare, in the healthcare setting or at home. And then we set upon the path of building those capabilities for the first time in an industry that hadn't done that, and then implementing them and putting them in our patients' hands, in our members' hands, in our physicians' and nurses' hands. It was completely the start of a really big wave of change in healthcare. That set of changes is still upon the industry, because the broader industry hasn't embraced it fully. And it's my view that the entire industry has to, in order to really create the kind of the best outcomes for patients, but also start to make healthcare, I always use the phrase, to make healthcare delightful. And it isn't for most people.
So a couple of questions along those lines. You felt that in order for Kaiser to be innovative, to develop the cutting edge and be competitive, actually at the forefront, basically leading the industry, you wanted to actually basically build your own lab, right? So your innovation center. Some of the technologies that came out of that, I think one of the ones that you described was a mat that an at-home patient could sit on, and all their vitals would be collected and emailed back, so to speak, or sent back to the doctor at the hospital. And so it was a virtual home visit from the doctor. Is that currently in use with Kaiser? And what were some of the other technologies that came out of your innovation center?
Some of the things we were doing there were probably 10 years in the future. So not all of them were implemented immediately, like this year, next year, the year after. Many things did get implemented. The ability to integrate a home care setting that allows us to essentially know when patients are not being as mobile as they need to be. For instance, you're sitting on the couch too long.
Right.
And then basically give you a notice that you should get off the couch.
Yeah.
You haven't taken your pills today, so being able to monitor that in real time and understand from a pill dispensing perspective that you always take a particular pill at 9 o'clock, and today it's 11 and you haven't taken it. So the dispensing mechanism in your home actually alerts you should be taking your medicine. A whole host of things, from access to a refrigerator, to sitting too long, to someone might have fallen in their home, and being able to actually have our system get activated to go and deal with a patient fall in the home. So particularly for older patients who might be alone, this kind of safety net was what we were envisioning.
Yeah.
We actually envisioned it going even further from the home into the car, to being able to have a patient walk out of a house, sit in a car, and have a full video interaction with a physician, and at that moment decide if that patient could be handled at home or needed to go to the hospital, and with the vision of autonomous cars, eventually have the car be able to take the patient to the hospital.
Oh, wow.
So we actually were working on that kind of pioneering vision 4 or 5 years ago,
Oh my goodness.
way before people were talking about these things. So the Innovation Center gave us a setting that allowed us to really think out of the box and think about decades into the future and how healthcare might change.
What is personalized health? Because Kaiser kind of defined that 10 years ago. You did, right?
You know, the phrase I used, and I really wanted to define it beyond purely a personal interaction, and I always said healthcare is personal, so therefore it's about you. You start from that position. Healthcare, though, could be real time, particularly today with the type of technologies we all carry with us in our pocket. And I've always said my mobile phone knows me better than anyone. It knows where I am, it typically knows what restaurants I go to, it knows a lot of things about me that have some value in the health system and in my treatment and care. That kind of personalization is truly where healthcare needs to go. But it should be real time. So it actually should be in my life each day and helping me and supporting me to live a healthier life. Beyond that, today we have all the DNA kind of testing and all kinds of views on how DNA and our knowledge of DNA and how it's being advanced can play into this as well. The way we looked at it was, you're with your physician maybe 1% of the year, but you're at home and your eating habits, the groceries you have available to you, the places you live and frequent, just the environment has an effect on your health, much more so than your physician does.
Yeah.
So it's up to a care system to integrate the physician, the support team, and the nurses and others, and that other 99% of your life in a very personal way, but not an obtrusive way, to really enable individuals to care for themselves and improve health and take responsibility for their own health. So personalized healthcare, real-time personalized healthcare is truly about you.
How is all of this data that's being collected, particularly within personalized health, it's such personal data, how is that being protected, and where that obviously was another huge element of what you had to be responsible for with HIPAA and some of the privacy laws?
It sure is. I think anyone in healthcare has a burden and a responsibility to the patients and their privacy, and to obviously their employees and their privacy. I mean, security was an area, a decade ago we kind of stumbled into, particularly in healthcare. It wasn't an area that was focused on as it is today, and people weren't spending both the money and they weren't spending the resources on it. I made a promise very early on, and it was on-camera promise to the Kaiser community, that we would do everything that we possibly could to protect their privacy. Because we were fully going electronic. Electronic medical records certainly knew everything about you, and your health history is unique. When someone actually penetrates those systems and steals that, they own that forever. It's for the rest of your life. So there's a real responsibility in healthcare to go above and beyond from a protection standpoint. That's not to say everyone's doing it perfectly or flawlessly today, but the need to spend more money on it, the need to use modern tools, AI, cloud, and other capabilities in an advanced way from a security standpoint is there, and is critical that the whole industry takes up that responsibility. That said, I always felt it was my obligation as the CIO and it was the CEO's obligation to not only promise but deliver. And we had to put our money where our mouth was. We, more than quadrupled the monies we were spending during my tenure at Kaiser, and even my next organization, we did the same. Security has taken up a large piece of the budget, but it's also the modern toolkit, I believe, actually will allow us to not continue that growth rate in spending and deliver even a more effective set of security capabilities that protect people's privacy.
So this is not the first time you've been in an industry that has to be focused on developing and becoming an early adopter of the cutting edge technologies, right? Your career started in financial services, which for a long time had the wonderful reputation of being the early adopters of technologies because they had this big thing called legacy systems. I think you're probably at another crossroads of when in financial services, the legacy systems that potentially currently existed even before the 90s that got changed out in the 90s probably need to maybe be refreshed again. Tell us a little bit about that trail, because you came up through financial services, you had that wonderful stint in healthcare, and then you just retired out of financial services, CIO, a position that the company actually created specifically for you, is my understanding.
I don't know that they created it for me, but the position was the first of a kind in the company, and the company was almost 100 years old. It was the global CIO for a very large insurance company. And effectively, when I looked at the whole financial services industry, and I did grow up in financial services, so I had a sense of pride about what we were doing 20 years ago. Coming back to it, I was very disturbed by what I'd found. And it's not just at the firm I worked in, but the entire industry, having gone through the last decade of crisis and having to really dig out of that crisis, is now in a position where the legacy in most financial services companies is quite abundant. Some companies, the systems are as old as 40 years. And when you're faced with that challenge as a CIO in any company, you truly want to go as fast as you can to change those systems out. But you have to also be mindful, particularly in public companies, of how you're going to make that into a return for the shareholder, and also satisfy all your constituents, and then satisfy your obligation as a shepherd of the company to ensure that the company is sustainable on a long-term basis. And balancing all of those elements when you're making decisions like that about a company with 40-year-old technology is extraordinarily challenging. Your question a moment ago about security, the need to really protect systems that didn't envision the world we're living in today, is an overwhelming challenge, and really building the kind of security capabilities to protect 40-year-old systems along the side of modern systems is a unique set of issues that I think the financial services industry as a whole, the insurance industry in particular, has to deal with.
Well, we can't really get into talking about financial services without talking about the big elephant in the room right now, Bitcoin, the cryptocurrencies, and the technology that I actually appreciate a lot more, the blockchain technology. Where is financial services vis-a-vis the cryptocurrencies, the Bitcoins that are out there? Is that truly a disruptor? Is that around to stay? Are they at some point going to be able to adopt cryptocurrency on their own traditional platforms?
Well, I'd say two things about that. One, I'm not an expert, so I'll guide with that, or lean in with that. Cryptocurrency, is new and interesting, and certainly has been volatile. And I think a lot of us have seen the volatility. Equally, we've seen some of the heads of some pretty substantial financial institutions come out and say that they're not that interested in the cryptocurrency space. That they haven't said the same about blockchain as a technology. And I know for a fact there's a good deal of investment being made across financial services in the potential capabilities that blockchain, it's now a promise. It's up to the industry to engage with it, and then ultimately either fulfill the promise or determine that that's an empty promise. In terms of the overall and overarching capability that's in blockchain. Blockchain in insurance, we were specifically looking at it when you think about title insurance.
Right.
And it's the titles insurance industry can be completely disrupted by what blockchain brings to the fore. There are other parts of the industry where you can actually look at blockchain and say, yes, it's the right technology for the right problem. Like any technology, it's answering that question. What's the right problem? It is, so it's a technology that's interesting. The industry is still learning about it, still developing capabilities to leverage it, and still trying to determine where it plugs in.
How do you go about determining your technology? So you've now moved into being a strategic advisor to several of the well-known venture funds, both in Palo Alto and nationally located. You sit on the board of advisors and board of directors of several startup technology companies, cutting edge technology companies. How do you decide where you're going to place your bets, right? And you have both in terms of capital investment, but more importantly, the more precious of your assets is your time. How do you actually decide where you're going to spend your time? Because you're in demand.
Well, I do spend time and have spent time for years and years in the startup space, and did that even when I was a CIO in a large company. I made time for the Silicon Valley community and the investment community in that space because what they were doing was going to be tomorrow's solutions. And I wanted to have a sense of that as I was planning the path for the companies I was associated with as one of the leaders. But today, one of the great things about being a CIO of a decade, there's a lot of problems you're faced with that just don't have solutions. Particularly in the blend of systems that you deal with in the corporate world, where even something as simple as passwords and being able to solve that. And when phones first came out, I looked at my team, and I had great engineering teams, and said, okay, my phone knows me. Why do you need anything else?
Right.
So there's so many ways to ultimately solve the security problem there. When I think about the companies I'm getting involved with, I'm tending to get involved with companies that are solving problems that I was faced with as a decision maker and CIO over this past decade that had no solution. And I think now that we're in this new age of technology between cloud and AI and some of the other toolkits that are out there around analytics, the world is about to change again, and these particular tools are making the solutions possible. And after a decade of wanting to solve something, I tend to gravitate toward companies that are solving the problems I had in the roles I've had in the past, and then basically giving my time and spending time with them, because I know the solutions they're going to come up with. As a CIO, I would buy, and as a leader in industry, I would buy because they will change the art of the possible for the companies that are out there, either from a service perspective, or from a privacy perspective, or from a product perspective. So when you think about those things, those are truly fundamental change that's coming to every business, specifically the industries I've been in, healthcare and financial services. The changes are going to be substantial, and the technologies I'm seeing are making me extremely optimistic about being able to solve some of these problems.
Oh, that's great. That's great. I think that would make you a valuable advisor to those companies too, the user perspective, but also the understanding of how that technology needs to interact with the rest of what exists at a company, because it's almost unrealistic to expect. It used to be when some of the big systems came out, they would say, well, you need to throw away your current legacy systems and install all of this, and it's like, that's just not practical for large organizations. It's not practical for anybody.
Well, it's given the install base and the amount of money that organizations have spent over the years, usually it's 2 to 3 times to maintain a system versus implementing. They've spent a fortune on that, and it's you can look at it and say it's a sunk cost, let's move on, but it's unrealistic in a real world where you have to deliver the next quarterly result. And systems that can solve big problems in the current world, that's a real world, make a real difference.
What do you think of the disruptions that are coming into financial services with the fintechs that will take away 25% of their traditional business?
I think it's the whole disruption conversation, and it has been I've participated in that conversation for almost 40 years. So that makes me a little older and now hopefully a lot wiser. The reality is that there's been innovation happening outside of the major institutions for decades. The value that that brings is entirely new way of thinking. And many of these major institutions have been around for 100 years. And there's a reason they've been around for 100 years, because they've been capable of adapting and adopting. And their ability to adopt those technologies, because of their scale, which gives them time, it tends to buy them time. It doesn't buy them absolution from the changes that are coming, but they, the burden they have is, how do we pivot our business to take advantage of these innovations and then leverage them into our core? And it's a consistent integration problem of leveraging new technologies while they sustain their old business, and then their business model spinning into an entirely new business model, which is, it's an artful dance that happens in major corporations in terms of how they have to leverage these innovations. But I've lived through decades of you're going to go out of business because these little companies are going to completely dominate and take your business away. While that happens sometimes, Amazon being an example, in the banking world, financial services, insurance, there's an element of trust that we all have in the major financial institutions that must be present for us to do business with these new technologies. There are some startups that are promising, and with a new generation, millennials and younger, coming up in an economy and in a world where sharing occurs and where they're used to having the information out there, older institutions may have a different meaning. And some of these firms will take some business, but the older institutions have scale and resources. And I would never underestimate the benefit that scale and resource brings. With leadership that is actually thinking ahead and being willing to take the business through change.
Real or not real? And nanorobots in the blood.
Real.
Real. He was saying, I guess actually I saw an interview with you where you're talking about there's IPs on your organs. You can put an IP address on your organ.
Well, I believe that we're going to see that become very real in our life. I'll call it our lifetimes and our children's lifetimes, and it's going to be meaningful in how it helps people be healthy and ultimately recover. So I think we're at that point where medicine is going through a meaningful change. People keep telling me that it changes very slowly, and I remember being told that when I went to Kaiser. Equally, I was told not to practice medicine because I'm not a doctor. At the same time, people like me need to keep pushing the medical profession, and the people in the medical profession that are on the leading edge, particularly physicians that are, and we used to call them tech doctors, they have an affinity for these changes, and they'll also, in their language with their peers, drive the change that's necessary to take advantage of these types of technologies.
3D printing.
That's real.
Real.
Yep.
It's already real.
Yes, it is.
Is it real in pharmaceuticals? That was the part that I thought they actually have. I guess in 2015, the FDA actually approved the first 3D printed pill. And I'm trying to. I guess it depends on what are the materials that go into.
As long as you have the chemistry set, I suspect you can print the pill.
You can print the pill. As long as you have the chemistry. I like that. That's great. Gamification of pharmaceuticals.
I imagine that they're using AR/VR in the pharmaceutical industry pretty significantly.
So tell us a little bit what that is.
Really virtual reality, artificial reality, and all of the augmented reality, and the ability to look through a 3D world to really visualize atoms in medicine, and in pharmaceuticals, that's something that I'm sure they're doing today. And I do know in some of the laboratories and universities, they're doing some very special work on how to advance that technology with respect to the genome and other work that's underway to really get inside the genome and physically visualize how changes to it will affect it.
So that's actually hitting across all aspects of the healthcare community. An end to human clinical tests.
An end to human clinical tests. I imagine that at some point, if you can manufacture a human being, you probably can then go and do that. I don't know what. In that case, that's probably further out than I can imagine. Yeah,
sort of. At some point, and they were arguing that with simulation modeling, you can actually basically create a virtual human to see how it would interact.
Well, they do that today.
Yeah.
That said, you still ultimately need the the DNA and the human being
Yes.
to determine efficacy and potential risks. So at some point, I would imagine you have to have a human being step in, but
Yeah.
simulating those outcomes is what the pharmaceutical industry has been doing that for forever, with basic analytics.
Yeah.
Now with AI on the scene, their ability to simulate the outcome of treatment much more accurately.
Yeah. So what's next for you, actually? And you're putting together this fantastic portfolio of technology companies. Are you going to continue to specialize in the areas of technology that you wish you had when you were a CIO, full-time CIO?
I see myself doing this for a while.
Yeah.
At the same time, people ask me all the time, will I ever go back to another corporate role? And I say to people that, if the right corporate role would come along that excited me, where I could make a really big difference in the company and the outcomes the company is creating for their customers and shareholders, I'd be very attracted to that. I love being a corporate executive and doing that kind of work. I also, quite frankly, having backed into this newfound career, am finding it extremely exciting. I'm working with a good 10 startups. I'm working with a number of public companies that are, frankly, around the world. Didn't expect to be doing that, but from an advisory perspective and working with some interesting management teams who have very exciting challenges ahead in each of their cases, and the ability to influence the outcomes for so many companies has been very attractive.
Yeah. I think in this most recent issue of a well-known business school's journal, we all know who that is, there's an article, I think it's supposed to be provocative, but the author claims that there's no such thing as a corporate entrepreneur. I think you're proof positive that he's completely wrong.
Well, I could understand why someone might say that, right? Because there's a view, if you've done multiple companies as an entrepreneur, and you've operated without the safety net of a major corporation, because frankly, inside a corporation, you have a bit of a safety net. But you could come to the view that those people in those corporations can't be an entrepreneur because they're operating with a safety net. The reality is, in the right corporation, under the right conditions, where leadership accepts some failure, because entrepreneurs fail pretty regularly, as well as succeed, and sometimes they succeed really big, and where you can actually inspire that kind of behavior inside companies and support it and cultivate it, you can be a corporate entrepreneur, and you can completely take on the responsibility of changing your business. My former company, actually, even though I've had nothing to do with it, when they hired a new CEO, that CEO set up a division inside the company which is completely reinventing the insurance business, with a very senior executive who was president of Europe for the company formerly. And they have all the right characteristics there to potentially reinvent the insurance industry. But it's a bit of an experiment inside the company. So they're going to accept failure. They have to, by definition. They'll equally hope for great success in that work, and they'll support it, and are supporting it, which is very clear in many of their public pronouncements about what they're doing. Many companies need to do that, particularly older companies that have a tremendous history and legacy in their business. They have a responsibility as corporate citizens to take up the moniker of change and ultimately lead their industries forward. So you can be a corporate entrepreneur.
Spoken like a true strategic CIO, a COO, actually. Thank you. I appreciate your time today.
Thanks. I appreciate it. It was fun.